I'm Shannon Goldwater. I'm a mom to triplets. I'm from Arizona. Our children were born 4 months prematurely in 2002. They spent 4 months in an NICU before coming home. And to be honest, I was worried about walking and talking much more than anything else, and never imagined that they would have difficulty feeding and swallowing. One thing that I love about your program here that I also believe sets it apart from the others is that you offer a combination of different approaches. The evaluation is done by a full team that's looking at your child's skills and abilities, that's looking at the medical pieces that may be playing a role, the psychological pieces, and then any growth and nutrition questions and concerns. It's one thing to be heard, it's another thing to have what you're saying mean something, be part of the treatment plan. Your hospital and staff and team values one another. The gastroenterologist, a registered dietitian, a psychologist, and a speech and language pathologist, and in many instances an occupational therapist. And they're set up in a situation that allows them to have foster communication that saves tremendous amounts of time and heartache for families and their children. So that's like the miracle story about my son Lee. I might say, every time my son eats pureed food or finely chopped food, which this was the case with my son Lee, he chokes and coughs and gags and retches. The speech and language pathologist here, Dr. Amy Delaney, ordered a swallow study, and we had the swallow study, and she came back to me and said, how would you feel about trying to work on him drinking his nutrition as opposed to eating pureed foods and fine chopped foods? And I mean, my first reaction was, hallelujah, are you kidding? You actually see what I see, that there's a reason why he's choking and coughing and gagging. I came here, he was 100% tube fed, and within a matter of weeks, he was 70% by mouth without standing over him. And it was amazing to see my son, who dreaded every meal, choking, coughing, gagging, crying, finally be given a program that he was capable of doing, and seeing the success in him and how proud we were of him, but how proud he was of himself.